Development of a portable pneumothorax detection medical device for the first responder usage. Our goal is to provide a solution for a significant medical problem diagnosis and emergency victim by the first responder in order to support their decision making and to enhance the healthcare level, which is our vision as a biomedical engineer in Jordan and the whole world. Our proposed solution mainly designed to serve the life-threatening medical problem diagnosis, which is the pneumothorax, especially in the accident and emergency sites, due to the lack of the medical radiation modalities in these emergency victims, and the dependencies on primary techniques by the first responder to judge whether the patient suffered from a pneumothorax or not, which may also be not accurate enough to be the final judge. So now, what's the pneumothorax and what do you mean by that? The pneumothorax is a risky and life-threatening medical condition characterized by air accumulation in the pleural space, causes the lung to lose its negative intrapleural pressure and leads to parietal or complete lung collapse. This figure here shows the difference between normal and affected lungs. We can see here the lung which gets the pneumothorax in the right side and the normal one appears in the left side. Patient can get a pneumothorax according to certain injury or trauma to the chest. Here we can see the air trap into the pleural space between the lung and the chest wall. We can observe the tracheal shift toward the unaffected lungs during the pressure that associated to the air trap. As main two classes, the pneumothorax can be classified as a primary and secondary spontaneous pneumothorax. The primary spontaneous pneumothorax may develop without underlying lung disease. It can be also developed as a result of injury like medical intervention or direct or indirect trauma to the chest. The secondary spontaneous pneumothorax developed and associated with lung disease. The most severe case of the pneumothorax, and which is the core of our study, is the tension pneumothorax. The severe and dangerous stage of the pneumothorax is the tension pneumothorax, which results in progressive air accumulation in the pleural space, lung collapse, mediastinal shift, reduces the cardiac output, and severe hypoxia. Pneumothorax associated with significant clinical manifestations like dysapnea, hypoxia, tachycardia, sinuses, chest pain, jugular vein distension, partial or complete lung collapse, and mediastinal shift to the contralateral side. The need of this solution comes according to the danger of these associated clinical manifestations, which made the pneumothorax need for early diagnosis to save the lives, reduce the risk of the tension pneumothorax, to improve also the EMS decision making, and to enhance the patient outcome. The traditional diagnosis in hospitals depend on CT imaging technique, which subjected the patient under the risk of radiation, and its limited technologies not available in the emergency sites. For patient who has the pneumothorax, they can't wait until the hospital arrival to confirm they got the pneumothorax or not, due to the seriousness of the pneumothorax. Our proposed solution has special characteristics like invasive, portable, real-time monitoring, fast diagnosis, low-cost pre-hospital applicable, and suits the emergency victim. The system workflow, data acquisition, signal processing, motion and physiological analysis, decision support. Mainly in our design, we used two type of sensor. The first type of them, the max 300 sensor, which is used to return the cardiac physiological parameters such as the heart rate and the SpO2 and the blood. It used the principle of the PPG to reflect the oxygen status. Second type of the use sensor in our proposed solution is the MPU 6050 motion sensor. This sensor used the accelerometer and gyroscope principle to record the chest wall movement that reflected the respiration efforts from the left and right side to detect the symmetry and asymmetry respiration patterns. Here we can see the sensor that we used in our design. We can see in the right side the Max 300 and MPU 6050, and we use also the Raspberry Pi 4 Model B as the main processing unit in this design. This block diagram describes the system architecture, the data flow. It's started from the power supply, the Raspberry Pi. We can also see the used sensor max and MPU medical elastic belt, and then the LCD display to get the real-time out. Each sensor was individually tested and connected to the Raspberry Pi, then combined together as a one physical circuit because our need to get an integrated system. We get the output from each sensor and combined it also as a real-time plot to record all readings and to be easier for the first responder monitoring. As what I said, the Raspberry Pi used as a central processing unit supplied by 5-volt portable power to source the transport. The top figure at the right side shows the physical connection between the MAX 300 and two MPU 6050 sensors to record the chest wall motion from the both side. And the bottom figure shows the final prototype of our system as a band to button the patient chest, and the reading will be displayed on the LCD screen as a real-time upload divided into subplots. The MBU 6050 sensor shows high sensitivity to small orientation changes and ability to detect minor chest movement. The sensor that been used is programmed to communicate with Raspberry Pi through I2C serial communication standard. But there is problem raised. We can't connect the two sensors with the same I2C address via the same I2C bus. The MPU 6050 sensor, which returns readings from the right chest side, and MAX 300 sensor connected to the Raspberry Pi via the default I2C bus. And to solve the I2C address conflict, external I2C bus defined. We're interested to get two readings from each MPU sensors from both sides of the chest, which are the pitch and roll reads, calculated by the equations that written in the box in the left side of the presentation. And reading must shows as a combined real-time plot as the figure shown in the right side of the presentations. This is an illustration how I2C address conflict exactly solved. This is how to connect the MAX 300 sensors to the Raspberry Pi 4 via the default I2C bus, and here are the obtained cardiac physiological readings. As a final show, it combines with the real-time upload for easier monitoring. The MAX sensor has practical constraints, like it shows high sensitivity to the incorrect finger placement, to the immediate light interface, excessive pressing on the sensor, and blood flow variation. Some consideration taken and considered for reading optimization, like minimizing the ambient light exposure, minor fluctuations, ensuring will contact the skin. This figure shows the final prototype of our developed solution. Continue with this video to see the implemented proposed medical device.
We designed a smart rib belt made from a skin-friendly biomaterial. The belt is elastic, allowing it to fit different chest sizes comfortably. The belt is secured to the patient's chest using electrodes placed on both sides, ensuring stability during measurements. We integrated two MPU sensors, one in the left side and the other one in the right side. These sensors detect chest movement caused by lung expansion and contraction during breathing. In the center, we placed a max sensor which measures blood oxygen saturation, SpO2, and the heart rate. The collected data is displayed in real time on a screen, allowing continuous monitoring of the patient's vital signs. All sensor data is processed using a Raspberry Pi, which acts as the brain of the system. This is the final prototype of our project, and this is how the belt is positioned on the patient's chest. Thank you for watching.